Hi, this is Michael Autos, and today we're talking about herbal remedies and dietary supplements. First, a few words of introduction. These medications are plant-based substances that people use for medicinal or for health purposes. You can get them without a prescription, and legally they're not considered drugs, not even like over-the-counter drugs. And as a result, they don't really need the same proof of efficacy and safety that we normally think of when we think of drugs. These may include plant-based substances, synthetic purified chemicals, and they may be also referred to as herbal medications or botanical medications. Now, herbal medications and supplements are often considered natural, but there's really no guarantee that these substances are safe. In fact, legally, they've been classified as dietary supplements, which means that they are exempt from animal studies, clinical trials, and post-marketing surveillance, all of which are required for normal drugs and medications. There's a lack of adequate testing for drug interactions, and in fact, the FDA is actually obligated to prove that these drugs are unsafe before they can withdraw them from the market. There are many concerns that herbal medications may be inert or contain toxic, adulterated, misbranded, or contaminated materials. And there's a potential for a lot of variability in the natural potency of these substances or the methods in which they are processed. Now, in 2007, the FDA adopted a regulation which applied some quality standards to these substances, such as identity, purity, strength, and composition, which was a step in the right direction. We also need to remember that because these are herbal preparations, they may often contain hundreds of other active and inactive ingredients. Bear in mind that many of our common drugs are also plant-based substances. These include atropine, cocaine, ephedrine, scopolamine, aspirin, caffeine, digoxin, morphine, and Taxol. So being plant-derived does not make anything necessarily safe or natural. Finally, I want to point out that there are different mechanisms in which these drugs can interact with our drugs that we use in anesthesia and in medicine in general during the perioperative period. So the herbal preparations can have direct pharmacologic effects on patients. They can also have a pharmacodynamic interaction where they change the effect of some other drug at the effector site. Or there can be pharmacokinetic interactions where these drugs change the properties of another medication, its absorption, distribution, metabolism, or elimination. So with that introduction, we're going to discuss a series of different substances and just highlight some of the considerations that we want to be thinking about when we have patients taking these supplements in the perioperative period. The first substance is called coenzyme Q10. It's similar to vitamin K, and people take it as an antioxidant to help reduce blood pressure, to treat heart failure, Parkinson's disease, and cancer. Studies have shown that coenzyme Q10 can decrease warfarin activity, while other studies have shown that it will increase warfarin activity. It's recommended that patients stop taking coenzyme Q10 2 weeks before surgery, especially if they are taking warfarin. Fish oil, which is an omega-3 fatty acid, is known to inhibit platelet aggregation. People take fish oil for coronary disease and hypertension, to lower their cholesterol, and as an anti-inflammatory medication. This is the first of many substances we will talk about today that increase risk of bleeding, and caution should be used in patients who are taking antiplatelet or anticoagulant medications. It's recommended that patients stop taking fish oil 2 weeks before surgery. Glucosamine and chondroitin are substances that are components of the proteoglycan, which is used to make cartilage. Patients who have osteoarthritis often take these supplements. Studies have shown that they can cause or worsen diabetes and may increase bleeding when taken together with warfarin. We recommend that patients stop taking these supplements 2 weeks before surgery. Vitamin E inhibits platelet aggregation and also antagonizes certain vitamin K-dependent clotting factors. Patients take vitamin E to prevent stroke, myocardial infarction, and atherosclerosis, and as an antioxidant. As expected, vitamin E can increase the risk of bleeding, and caution should be used in patients who are taking antiplatelet or anticoagulant medications, and vitamin E should be stopped 2 weeks before surgery. So we've just talked about a few vitamins and other supplements, and now we're going to move on to some of the more plant-based materials that we commonly see people taking under the moniker of herbal medications. The first is echinacea, also known as purple coneflower. This drug activates cell-mediated immunity, and patients take it to enhance their immune function and to prevent or treat respiratory, urinary tract infections and such. Side effects of this substance include rash, nausea, and allergic reaction, a decreased effectiveness of immunosuppressant medications and steroids. However, with long-term use, there may actually be immunosuppression. Echinacea has been associated with hepatotoxicity, and so we should avoid hepatotoxic drugs, and probably should also avoid them in immunocompromised patients. There's no data currently for a recommendation on when this drug should be stopped, but many people recommend stopping it 2 weeks before surgery. Ephedra, also known as mawang, is a direct and indirect sympathomimetic substance. It is related to ephedrine. People take it as a diet aid or a stimulant. They also may use it as a bronchodilator to treat asthma. The sympathomimetic effects can cause myocardial ischemia, stroke, and hypertension. Caution should be exercised when used with halothane because it may precipitate ventricular arrhythmias. And we might expect some interaction with monoamine oxidase inhibitors. Patients may have increased or blunted sympathetic effects, depending on whether they have experienced depletion of their endogenous catecholamines. And we recommend stopping ephedra 24 hours before surgery. Garlic and its extracts are known to inhibit platelet aggregation. Patients take garlic to prevent myocardial infarction and stroke, as well as to lower blood pressure and lipids. Garlic can increase the risk of bleeding, and caution should be used in patients who are taking antiplatelet or anticoagulant medications. Garlic supplements should be stopped 7 to 14 days before surgery. Ginger inhibits serotonin pathways and inhibits platelet aggregation. Patients take ginger to prevent nausea, both cancer, chemotherapy-related nausea, and even nausea associated with motion sickness. They also take it as an anti-inflammatory. Patients taking ginger have an increased risk of bleeding, and caution should be used in patients taking antiplatelet or anticoagulant medications. There does not currently exist any data for when ginger should be stopped before surgery. Ginkgo biloba inhibits platelet activating factor. Patients take this medication to treat claudication, which is sort of like angina in your legs when you have vascular disease. Ginkgo seems to improve the viscosity of blood and therefore improves tissue perfusion. Patients also take it as an antioxidant and to prevent dementia. Ginkgo leads to an increased risk of bleeding, and caution should be used in patients who are taking antiplatelet or anticoagulant medications. Patients may also complain of GI upset or headache, and this substance should be stopped 1 to 2 days before surgery. Ginseng is a substance that acts as a sympathomimetic. It also inhibits platelet activity and lowers blood glucose. Patients usually take it as a mood enhancer and as an antioxidant. Ginseng can cause an increased risk of bleeding, and caution should be used in patients who are taking antiplatelet or anticoagulant medications. Surprisingly, ginseng has also been shown to decrease the effect of warfarin. Patients taking ginseng may experience tachycardia and hypertension, as well as sleeplessness and mania. There is a risk of hypoglycemia, and blood sugar should be watched carefully, and there may be an interaction with monoamine oxidase inhibitors. Patients taking ginseng should stop the medication 7 days before surgery. Grapefruit juice is known to inhibit the cytochrome P450 subunit 3A4. Patients use grapefruit juice for cardiovascular health. But due to its inhibition of the cytochrome subfamily, grapefruit juice can prolong the effect of a number of different medications by inhibiting their metabolism. These drugs include antihistamines, calcium channel blockers, midazolam, lidocaine, warfarin, digoxin, HIV drugs, cyclosporin, which is an anti-rejection drug, and many, many others. There is no data on when grapefruit juice should be stopped before surgery. Green tea inhibits platelet aggregation, seems to contain some vitamin K, and may have a diuretic effect. Patients take green tea for weight loss, mental alertness, cancer prevention, and as an antioxidant. Green tea may increase the risk of bleeding, and caution should be exercised in patients who are taking antiplatelet or anticoagulant medications. Due to its vitamin K effect, green tea may actually decrease the effect of warfarin, and patients should stop taking green tea 7 days before surgery. Kava acts by potentiating GABA, and so people use it as a sedative or an anxiolytic. And we expect that it will potentiate other sedatives when used in conjunction. Patients may experience increased sedation when given anesthetic medications. However, chronic users may have tolerance and therefore have increased anesthetic requirements. Chronic users also may have dependence or withdrawal symptoms from this medication, and it may be abused. Kava has been associated with hepatotoxicity, and it may cause dystonic-like reactions similar to Parkinsonian symptoms. Kava should be stopped at least 24 hours before surgery. However, we should be aware of the possibility of withdrawal before we instruct a patient to stop taking this medication. St. John's wort, also called hypericum, induces the cytochrome P450 3A4 subunit. It also inhibits reuptake of many neurotransmitters like serotonin, epinephrine, norepinephrine, and dopamine. People take St. John's wort for depression and for anxiety. It causes sedation and hypomania, which is like a mild depression. Side effects include serotonergic crisis due to serotonin reuptake inhibition. And it acts kind of like the opposite of grapefruit juice. Since it induces the 3A4 subunit of cytochrome P450, it will increase metabolism of many medications, leading to decreased plasma levels of antihistamines, calcium channel blockers, midazolam, lidocaine, warfarin, digoxin, HIV drugs, cyclosporin, and many, many others. It is recommended to stop taking St. John's wort 5 days before surgery. Saw palmetto has an unclear mechanism, although it may be involved in blocking conversion of testosterone to dihydroxytestosterone. Patients take saw palmetto for benign prostatic hypertrophy. Caution should be used when this medication is given together with anticoagulant or antiplatelet drugs. But there's no current data on stopping saw palmetto before surgery. Valerian also potentiates the GABA receptor, and people take it as a sedative and an anxiolytic. Patients taking valerian may see increased activity of other sedatives and may experience increased sedation. However, chronic users may have increased anesthetic requirements. We should be concerned for the possibility of dependence on this medication or abuse, and patients may experience withdrawal symptoms when the drug is stopped. There is no current data on stopping valerian before surgery, but many recommend stopping it 2 weeks in advance, bearing in mind that some patients may go into withdrawal if the drug is stopped suddenly. Those are the substances that we're going to discuss today. We look forward to seeing you in class where we can go over them in some more detail.